NHA Medical Assistant Exam Questions. Question 1. Bones are joined to muscles by ligaments, periosteum, cartilage, tendons. Tendons attach muscle to bone. Ligaments attach bone to bone. Periosteum is the outer covering of bone, cartilage cushions joints, and meninges cover the brain and spinal cord. Tendons are fibrous connective tissue that transmit force from muscle to bone. Question 2. Multipara means many near, many nearby, many pregnancies, many live births. Multipara, multi equals many, para equals live births, refers to a woman who has had 2 or more live births. Nullipara means no live births, primipara means 1 live birth. This terminology is used in obstetrics to describe a woman's obstetric history. Question 3. Which of the following does not describe Schedule IV drugs? Physician must sign a triplicate prescription. Can be refilled 5 times over 6 months. Can be called into pharmacy over phone. Frequently abused. Only Schedule II drugs require a written, non-refillable prescription on a triplicate form. Schedule IV drugs, e.g., Xanax, Valium, have lower abuse potential, can be called in, refilled up to 5 times in 6 months, and must be stored securely. Question 4. Which region is referred to when charting a notation about the area near the navel? Suprapubic, epigastric, umbilical, hypochondriac. The umbilical region surrounds the navel. Epigastric is above the navel, suprapubic is below, hypochondriac is below the ribs, and lumbar is in the lower back. Accurate anatomical terminology is essential for precise documentation and communication among healthcare providers. Question 5. Which term did Freud use to describe the area of the mind that determines a person's basic identity? Ego. ID superego. Unconscious mind. The ego is the conscious part of the mind that represents one's identity and mediates between the ID and superego. The ID is primitive instincts, superego is moral conscience, and the unconscious holds repressed memories. Understanding these concepts helps in patient communication and behavioral health. Question 6. Which of the following words means without menstrual flow? Nullipara, amenorrhea, oligomenorrhea, dysmenorrhea. Amenorrhea, a equals without, menorrhea equals menstrual flow, is absence of menstruation. Oligomenorrhea is scant flow, dysmenorrhea is painful menstruation, nullipara means no live births, and nulla gravida means no pregnancies. These terms are used in gynecology to describe menstrual disorders. Question 7. Which of the following food items would not be consumed by a lacto-vegetarian? Rice, eggs, beans, milk. Lacto-vegetarians consume plant-based foods and dairy but not eggs, meat, or fish. Eggs are excluded. Vegans exclude all animal products including dairy. Understanding dietary restrictions helps medical assistants provide appropriate patient education and meal planning. Question 8. The act that protects patient rights, including the right to agree to or refuse medical treatment, is the Patient Self-Determination Act of 1990, Consumer Protection Act of 1971, Civil Rights Act of 1964, HIPAA Act. The Patient Self-Determination Act requires healthcare facilities to inform patients of their rights to make medical decisions, including creating advance directives. HIPAA protects health information privacy. The ADA prohibits discrimination against disabled individuals. Question 9. The condition in which blood accumulates due to a tear in the meningeal layer is concussion, subdural hematoma, intracerebral hematoma, epilepsy. A subdural hematoma is bleeding between the dura and arachnoid mater, meningeal layers. Intracerebral hematoma is bleeding into brain tissue. Concussion is temporary brain dysfunction from trauma. Epilepsy is seizure disorder. Hydrocephalus is fluid accumulation in brain ventricles. Question 10. The abbreviation for potassium is P-Fe. K-O. K is the chemical symbol for potassium, from Latin kalium. P is phosphorus, Fe is iron, O is oxygen, and PM is promethium. Medical assistants must know common lab abbreviations for accurate documentation and communication with laboratory staff. Question 11. Which of the following is not an early warning symptom of cancer? Sore that does not heal. Pain and weight loss. Unexplained bleeding. Chronic cough or hoarseness. Pain and weight loss are advanced symptoms of cancer. Early warning signs include a sore that doesn't heal, unexplained bleeding, a lump or mass, chronic cough or hoarseness, change in bowel/bladder habits, mole changes, and persistent indigestion. Early detection improves survival rates. Question 12. Which practitioner would treat patients for ADHD, PTSD, and bipolar disorder? Psychiatrist, hematologist, gynecologist, rheumatologist. Psychiatrists diagnose and treat mental health disorders including ADHD, PTSD, and bipolar disorder. Hematologists treat blood disorders, gynecologists treat female reproductive system, rheumatologists treat arthritis and autoimmune diseases, and pulmonologists treat lung conditions. Question 13. All of the following are duties performed by the Public Health Department except collecting data on communicable diseases, recording vital statistics of animal bites and injuries, predicting and managing epidemics, managing Medicare and Medicaid. Medicare is federally managed and Medicaid is state managed. Public health departments track communicable diseases, vital statistics, births, deaths, animal bites, injuries, and epidemics. They also provide immunizations, health education, and disease prevention programs. Question 14. Which of the following waves represents relaxation of the ventricles? P wave, Q wave, QRS complex, T wave. The T wave represents ventricular repolarization, relaxation. The P wave is atrial depolarization, contraction, and the QRS complex represents ventricular depolarization. The U wave is not always seen and may indicate electrolyte imbalances. Understanding EKG waves is essential for recognizing cardiac abnormalities. Question 15. The term carcinogenic means formation of tumors, pertaining to tumors, pertaining to destruction of tumors, pertaining to formation of cancer. Carcinogenic, carcin/o equals cancer, genic equals forming, means cancer causing. Oncogenic also means cancer causing. Medical assistants should educate patients about carcinogenic substances, e.g., tobacco, asbestos, UV radiation, and cancer prevention strategies. Question 16. The disease where the coating on the axon begins to disintegrate and slows neural transmission is called multiple sclerosis, myasthenia gravis, amyotrophic lateral sclerosis, ALS, cerebral palsy, Multiple sclerosis, MS, is demyelination of the axon, slowing nerve impulses. Myasthenia gravis is muscle weakness from acetylcholine receptor blockage. ALS is motor neuron degeneration. Cerebral palsy is a movement disorder from birth injury. Parkinson's is dopamine deficiency affecting movement. Question 17. Erythema may be caused by all of the following except sunburn, carbon monoxide poisoning, dermatitis, bowel problems. Bowel problems typically cause jaundice, yellowing, not erythema, redness. Erythema is caused by increased blood flow to the skin from sunburn, dermatitis, blushing, or carbon monoxide poisoning, cherry red skin. Recognizing skin color changes aids in differential diagnosis. Question 18. Which term means the process of using an instrument to record data of electrical activity of the heart? Electrocardiography, electrocardiograph, electrocardiogram, echocardiogram. Electrocardiography, graphy equals process of recording, is the process of recording the heart's electrical activity. An electrocardiograph is the instrument, and an electrocardiogram, ECG, is the tracing produced. Echocardiography uses sound waves, not electricity. Question 19. If an elderly patient refuses an antibiotic injection, but the medical assistant holds the patient down and gives it anyway, this is legal. Legal but unethical. Assault. Battery. Battery is intentional, unconsented touching. Assault is the threat of touching. Holding the patient down and giving the injection without consent constitutes battery, which is illegal and unethical. Patients have the right to refuse treatment, even if the provider believes it is in their best interest. Question 20. A papule with clear fluid is called a pustule, vesicle, macule, nevus. A vesicle is a small blister filled with clear fluid, e.g., chickenpox, herpes. A pustule contains pus, a macule is flat and non-palpable, a nevus is a mole, and a nodule is a solid, raised lesion. Accurate skin lesion terminology is essential for dermatologic documentation.